Okay, picture this. You're looking at sustainability reports for two totally different healthcare organizations. On one hand, you've got this massive, sprawling hospital network spanning multiple cities. On the other, a single, independent outpatient clinic. So, how do you actually compare their environmental impact fairly? I mean, if we just look at the raw numbers, it's the ultimate apples to oranges problem, right? The massive hospital is always going to look like a much heavier polluter simply because, well, it's bigger. But does that automatically mean they're less efficient? Or are they just doing a whole lot more work? Welcome to This Explainer. Today, we're tackling a really critical concept in healthcare sustainability reporting, and that is how to track general activity metrics to normalize healthcare sustainability data. We're going to see exactly how counting specific things, specifically the total number of facilities, beds by type, inpatient admissions, and outpatient visits, can take raw, chaotic data and turn it into clear, comparable insights. Here is our game plan for today. We'll start with the healthcare data dilemma, bring in the SASB framework, and uncover the missing piece, activity metrics. Then we'll get into counting facilities and beds, tracking admissions and visits, and wrap it all up by normalizing for true sustainability. Let's jump right into part one, the healthcare data dilemma, the problem of scale. So the healthcare delivery industry is incredibly complex. They manage everything from major life-saving surgeries to minor rehab appointments, which means massive fixed costs. And this brings us to a huge reporting dilemma. Let's say our massive hospital network reports 1,000 metric tons of medical waste for the year. Meanwhile, our small clinic reports just 10 tons. If you're only looking at absolute numbers, that clinic looks like an absolute sustainability champion, right? Like they're generating 100 times less waste. But wait, is the clinic actually 100 times greener? No way. The hospital might be treating tens of thousands of really complex inpatient cases, while the clinic sees just a tiny fraction of that volume for minor stuff. Basically, absolute numbers without context are completely chaotic and super misleading. We need a way to level the playing field. To fix this, we're moving to Section 2. Enter the SASB framework, the standard for disclosure. To actually solve this apples to oranges problem, we rely on the healthcare delivery standard from the SASB standards, which, by the way, are now maintained by the International Sustainability Standards Board, or the ISSB. Now, this specific standard, version 2023-12, gives us a really comprehensive set of disclosure topics and metrics made specifically for the healthcare sector. It lays out how these entities should report on everything, from energy and waste management to patient privacy. But buried within this framework is a very specific tool designed to fix our exact data dilemma. Which brings us to Section 3, the missing piece, activity metrics, unlocking data value. We need to understand exactly what these are. The standard officially defines activity metrics as metrics that quantify the scale of specific activities or operations by an entity and are intended for use in conjunction with other metrics to normalize data and facilitate comparison. Think of it like a giant fraction. If your raw sustainability data, like your total energy consumed or total waste generated, is the numerator, your activity metric is the denominator. It's the piece of the puzzle that finally gives that top number its scale and meaning. And look at Table 2, straight out of the SASB Healthcare Delivery Standard. There are exactly two activity metrics required for this industry. They are quantitative, and the unit of measure is literally just a number. These two specific rows are the master keys to making all other sustainability data and healthcare comparable. So let's break them down. Moving into Section 4, counting facilities and beds, measuring physical capacity. Okay, metric number 1. The official alphanumeric code for this is HCDY000.A. Whenever you see this specific code pop up in a sustainability report, you know the organization is establishing their physical footprint. This metric requires an organization to disclose 3 distinct things: the total number of facilities, the total number of beds, and this is the crucial part. They have to be categorized by specific type. Why does type matter so much? Because healthcare facilities are incredibly energy intensive, but not all in the same way. The energy footprint of a massive 500-bed acute care surgical hospital is a completely different beast compared to a 50-bed psychiatric facility or a handful of primary care offices. By counting facilities and beds by type, we establish the baseline physical capacity. We're essentially defining the size and shape of the container before we ever try to measure what's going on inside. Which leads us to Section 5, tracking admissions and visits, measuring human flow. Because physical capacity is really only half the story, right?
An empty hospital obviously uses a lot less energy than a completely packed one. So here is our second vital signpost, straight from the framework, HCDY000.B.
This metric zeroes in on the actual volume of patient care provided. It asks entities to disclose the number of inpatient admissions and the number of outpatient visits, and it is absolutely vital to separate those two out. Think about it. An inpatient admission, where a patient stays overnight, maybe they're having surgery, needing 24/7 monitoring, eating hospital meals, that has a massive operational intensity. It takes way more resources, creates way more medical waste, and burns through a lot more energy. An outpatient visit, on the other hand, where someone just comes in for a quick checkup and leaves an hour later, has a much lighter footprint. By tracking these numbers separately, we accurately capture the true human flow and the real operational intensity of the organization.
All right, here comes the aha moment. Section 6, Normalizing for True Sustainability.
Let's apply this to energy management. The standard says entities have to report their total energy consumed in gigajoules. Again, a massive, scary number on its own tells us pretty much nothing. But if we take that total energy consumed, our numerator, and we divide it by the total inpatient admissions, our activity metric, denominator, we unlock a super powerful new data point: energy consumed per inpatient admission. Boom. Now, suddenly we can actually compare that sprawling hospital network directly to a smaller regional hospital. We aren't just looking at who is bigger anymore. We are looking at who is more efficient per patient treated. Let's do one more example with waste management. We know healthcare facilities generate tons of regulated medical waste. Looking at the raw data, total metric tons of waste, it's chaotic. It's really hard to compare. But when we apply our activity metric, we get normalized data: medical waste generated per inpatient admission or per outpatient visit. This is a total game changer. It allows analysts, investors, and honestly the hospitals themselves to see if their waste reduction strategies like better recycling or segregation are actually working on a per-patient basis. And that holds true regardless of how fast the hospital itself might be expanding. Ultimately, tracking the total number of facilities, beds, admissions, and visits isn't just some boring bureaucratic box-ticking exercise. It's really the only way to make sustainability metrics actually mean something in the healthcare sector. It takes raw, disconnected numbers and turns them into a clear, actionable story about efficiency and impact. So I want to leave you with this final thought to chew on when you're looking at your own organization's practices or reading through these reports. Are you just reporting raw data out into the void? Or are you actively normalizing it to uncover real insights and drive real sustainable change? Thanks so much for joining me on this explainer.